welcome to the Neosis webinar. My name is Heidi Dubois, and I am the Business Optimization Manager here at Neosis. Tonight, it gives me great pleasure to introduce you to Dr. Gavin Ewing. He is a Columbia-trained dentist with a passion for patient care. He loves innovation and technology, and after completing his residency at a VA medical center in LA, he sharpened his skills in endo, surgery, full mouth rehabilitation, and implantology. And since 2019, he's been thriving in a private practice. He now practices in the Northern California Bay Area, and he moved there to take up his favorite pastime, which is kiteboarding. I didn't even know what that was. He has been a proud robotic dental practice since 2022, and we are really happy to present Dr. Gavin Ewing. Thank you.
All right. Thank you very much, Heidi. Nice to meet everybody through the web. Today, I'm excited to talk to you guys about the power of predictable incision and how the Yomi surgical robot has absolutely revolutionized my practice and is completely changing the way that I do dentistry. So like Heidi was saying, I'm Columbia trained. I did a residency at Sepulveda VA, and I've owned my practice since 2019. I truly love dentistry. I love being able to provide a full scope of care. And so at this point, I would say that I kind of have a practice where we focus on taking care of patients with complicated dental needs, whether it's saving teeth, whether it's replacing them with implants, or whether it's doing cosmetic dentistry. We're here to stand out in a hyper-competitive California market by providing easier dentistry and better outcomes. And really, I think Yomi is a big part of what put me on this path. And I've been enjoying using the robot for the past 3 years, and it's completely changing the way that I take care of the surgical side and the restorative side of my practice. Obviously, when you're doing a practice like this, part of the most fun is that it does take a team. And so I'd really like to thank all of my team members. It's a program, it's in market, it's a task to implement, but realistically, the magic is when you can really train and implement your assistants and your associates, and that's a way for us to take care of more patients. And it's also a great way to get your team members engaged. And I'd also like to thank my fiance, Kim. She is a cancer researcher, and she really inspired me to take this leap towards the cutting edge of dentistry and have fun playing around and figuring out new ways to help people out. And so I'd like to thank my team and my fiance, Kim. Let's take a little glimpse at kind of a day in the life of a Yomi surgical practice. It's a pretty cool video. So obviously this is a collaboration with the Assistant Smile Makers my practice. And just a little glimpse around some of the technology. The support at Neosis is unbeatable. They're there for you all the time. If you've got any problems with the robot, any installs, or just any questions, you literally pick up the phone. 30 seconds later, you have your robotic advocate. It's unbelievable. And then accuracy, we're going to get talked about Dr. Jay Sardi coming up in a moment. Some really compelling information there. And it's really, it's the first way to have a real digital workflow, adaptable in real time, from start to finish, all the way from planning to placement to visualization, a true full digital workflow. Obviously, printing's changed the game. And ultimately, it's about the patients. We all live in those reveal moments. We all like being able to say yes to people that have been told no. We all like to know that we're giving our best all the time. Undeniably, if you want to be a Yomi user, it is about quality. You have to care about the outcomes, but when you care, you get these better outcomes, and it's a better experience, and it's just a better way to go home and sleep well at night. So let's get a little bit more into some of the details. So, hey, implants are amazing these days. So there's a lot of the original dogma that we thought we knew when implants first came out. That is, with the passing of time and more experience and better technology, is turning out to not be quite as true as we thought. We thought that implants always had to be splinted, but now that we know that more often than not, they can be individualized, they're easier to clean. We thought that implants can't be angled. I mean, for all of you knowing, during the traditional all-in-4 method, most of the time, we're doing those distal angulated implants, and we're having massive success for decades at this point internationally. We thought that, we needed long healing times, better coatings are coming out, better implants, and, we're having better success with early loading. We thought that we needed to have all these different size connections, but as we all know, there's a lot of really straightforward connections that are still achieving great outcomes. We thought we couldn't immediately load, and we know that we can now immediately load situations, whether it's one teeth, a few teeth, or all of a patient's teeth. And we thought we couldn't take care of medically complex patients. Obviously, that adds risk, but when we could do these precise surgeries that are less invasive, we're often able to help take care of more difficult and more challenging patients. And we also know that we're not losing as much bone around platforms. Ideas of platform switching and different implant connections, the groundworks taper in particular. I think that's really revolutionized our risk of periimplantitis, and that's really changing our confidence with implant treatment planning. So yeah, I think it's pretty clear that it's amazing how far implants have come. But what's next? How do we continue to improve patient outcomes? How do we give them better experiences? And how do we continue to raise the standard of care? And so, we've all seen the revolution that's happened in the dental space over the past, 3 to 5 years. CAD design coming in place, printing completely changing the game, CBCTs becoming massively available, photogrammetry becoming available, virtual smile design, photography, and it's just not stopping. I mean, it's like a full-time job these days to keep up with like the latest thing in dentistry. We've got AI taking over the industry at various different levels right now. And so, it's an exciting time, but it's definitely a lot to keep up. And so, you got to keep up, particularly if you're in a competitive market and you're trying to keep on the cutting edge and be able to provide the best outcomes for your patients. But I think Yomi is absolutely fundamentally one of these areas that is moving forward the possibility of high-level implant care. So, there's been a revolution in how implants have been treatment planned and placed. Obviously, we all started freehanding, and then we had static guides, and now there's been camera navigation. But Yomi really represents a definitive step forward. It's a haptic guided system. Once you're locked in on your digital plan, it almost feels like you're on a drill press. You're not just relying on your doctor's coordination anymore. The robot is like having a third arm. It's there to help you precisely deliver those implants to exactly the place that you've planned on your digital plan. And it's done in such a way that if you need to change anything, surgery is a dynamic place. Things change. If you need to change something during your surgery, just have your assistant hop on the computer, make a couple easy clicks, and you're moving forward and you're placing those implants every single time into the best possible position for your patient. So, some of the things that really stand out for me are obviously we're talking about accuracy and precision. Any kind of misplaced implants, in my opinion, is often what leads to, these early failures, dehiscence on the buccal plate or insufficiently depth leading to like periimplantitis. And so we know that with a guided system, you're going to be able to place implants more accurate and more precisely. But the thing that's really standing out is that you definitely are getting a lot higher initial primary stability when you're placing a robotically placed implant. I'm a very coordinated surgeon. I've been freehanding for over a decade. But if you're going to be able to place an osteotomy running at full speed with irrigation and have it perfectly placed within less than 1 degree of angle variation every single time and place that burr straight to depth at full speed and know that you're going to stop, within 0.5 millimeter or less of a stopping point, you're not going to get the same kind of spreading of the osteotomy with any kind of deviation in your angle between each of your drills. So we know that these robotically placed osteotomies are coming out tighter. And that little tighter osteotomy is giving us better initial stability, which is then allowing us to feel confident about some of these use cases that I'm about to show you in the case presentation part of this lecture. And then obviously, hey, we got to do this career for a long time. Sometimes you can't see upside down in the back of someone's mouth. And sometimes you need to be able to trust that your drill is running for your own ergonomics or just because it's an area that you can't get there. And so with Yomi, you have the confidence to stay ergonomically in the correct position and still know that you're delivering those implants to the perfect position. And then they're always, developing the prosthetic side of planning. We all know that crown down implant planning is becoming the standard of care, I would say, at this point. And so when you can literally have a visualization of like the ideal restoration that you're planning for and navigate your surgery in real time through the convenient software that is Yomi Plan, it just really allows you to keep that vision of the teeth that you're wanting to make and deliver to the surgeon, because ultimately patients are looking for teeth. They're not just looking for implants. They're looking for teeth that are going to look great, be comfortable, and pass the test of time. So one of my colleagues, Dr. Jay Newgarden, is a preeminent oral surgeon in New York. I think some of you might have seen him talk already. Have never had the fortune of meeting him yet, but I've heard he's a very smart guy, and he's done this really robust paper that was published in the International Journal of Oral and Maxillofacial Implants. He did a report on 274 implants that he placed with the Yomi surgical robot, and he found out that the Yomi robot was the most accurate and precise method for delivering implants to a certain guided position. It's significantly more precise than any other treatment used today. So we had a good number of cases here. The things that kind of really stand out to me, and the thing that I really experience in my day-to-day clinical practice, is that we talk about a confidence interval of 95% of 1.2 to 4 degrees of angle variation. So you're going to be placing these implants on angle with like less than 2 degrees of angle variation consistently every single time. So that means you're going to have more screw channels going through cingulums. You're not going to have implants deviating in crazy places. You're not going to have to worry about screw channels on the buckle of the prosthetic. That's really remarkable accuracy. The depth can be a little bit hard to control because ultimately that is up to the operator a bit more, but we're still having, less than 1 millimeter of degree of bodily position in regards to depth. In my clinical experience, it feels much less than that once you get used to using the right dual osteotomy, but still remarkable, like scientifically backed report on the accuracy and the performance of the Yomi surgical robot and providing, to being able to really be on target every single time. So thank you very much, Dr. Newgarden, for this paper. What does that mean? How is that going to set your practice apart? And ultimately, I think the modern practice is really changing. The days where you could put up a sign and just have a line of patients out the door, or you can just add a procedure and be, the only guy doing that procedure and get a line of patients out the door. But particularly in a competitive market like my own in the East Bay of the San Francisco Bay Area region, you need to find ways that are going to set apart your practice. And ultimately, I think the biggest way to do that is to find unique ways to take care of your patients and then get into marketing, because that's just the way it is these days. You have to learn how to market that unique patient experience to your patients and get your story out there. And that's really what the Yomi surgical robot has been helping me do. One of the first places that I personally benefited from adding the Yomi robot to my practice was in the ability to really do almost every single extraction as an immediate implant. So at this point, I would say at least 95% of the time that I'm doing an extraction and a bone graft, where the patient has already wanted to have the implant because they're paying for the bone graft, we're going to go ahead all in one day and place that implant at the same time. When we're doing these immediate implants, we're not seeing like drifting into sockets. We're not seeing skiving. It's because I can run those drills fast with irrigation, get a good purchase point with a lance drill, and then I can place those drills at speed right to depth without worrying about stopping or hitting into a nerve. We're getting truly prosthetically planned positions, but done predictably in an immediate setting. And also, I'm not having to stock like tons and tons of different crazy size implants. Like we're not rocking 6 millimeter, like 6 millimeter wide, 10 millimeter tall implants. We're actually able to consistently engage, 5 threads or so, thanks to Dr. Stanley's research, with like a medium-sized implant and predictably get 50 newtons plus millimeters of stability and go home and sleep well at night knowing that these immediate implants are going to be successful consistently. So, let's also think about the patient experience. Like from a practice point of view, if you're going to be getting the extraction, the graft, and the implant all in the day of surgery, that's more production for you on a typical emergency that you can add in. It's also easier if you can have your assistants restoring there and then, just wait 2 months and you can go ahead and deliver the crowns. Whereas in the traditional model, take out the tooth, let it heal for 4 months, place the implant, let it heal for 4 months. You're putting the patient through multiple surgeries. Often you're putting them through more expense and you're also taking more chair time. And so for sure, this was like the first place when I was really just getting my feet wet with Yomi, really getting comfortable with it, that I had an immediate change to my practice that affected my bottom line, really from day one. But it also is about, like I say, patient experiences. Here's Jake. Jake was actually one of my patients that I brought in for my 1 week Yomi onboarding. He had a failing bridge that had become symptomatic, and he was ready to get this restored, but he also had a lot of other decay and other issues in his mouth. we were able to take apart the bridge, two immediately placed prosthetically planned implants, approximating the inferior alveolar nerve, but not, being at risk of impinging on it. And end up sending him home with a provisional bridge in that area all in one day. And really do that in a way that he came back, he's a phobic patient, he was worried about having a lot of pain. And he reported it had very, very little discomfort. And that's a consistent thing that we're finding with Yomi surgery. I mean, our flaps are smaller, the procedure is quicker once the implants are going in. And typically we're getting a lot less bruising, a lot less post-op discomfort, and better patient experiences. So, he continued on with me at that point because we had built this rapport, and we got the pleasure of restoring his entire upper arch with a combination of implants and restorative work. And we're actually in the process of finishing his bottom arch. And this really all started from this incredible experience that he had when he came in to try out the robotic surgery experience. And so, yeah, another conversation that's really coming up in the dental space is obviously remote anchorage. Like, we've all seen those photos on Instagram. Hey, like, what if I could be the practice that can say yes to those patients that have, been told no? A lot of those patients, they already are familiar with the numbers. They've gone around to different consults and they've just been told, hey, you don't have enough bone. And that can be debilitating. I mean, some of these patients have no hope. Like, they just think that implants are the way they were and they're not going to be able to have teeth. And so, or some of these patients think it's going to be invasive, but you can come to them and you can tell them that because of this Yomi surgical robot, you can predictably take care of almost every single patient in as conservative a manner as possible. I would say that since I've been working with the Yomi surgical robot, I've never had a case that I couldn't solve that was an atrophic maxilla without Yomi. I never needed to do zygos, ever. I've seen maybe one patient that I might have considered doing zygos on. And I do market for cases that are tough cases. And so I know there's always going to be some cases, but, do we really need to be spending $40,000 traveling the world to learn zygos, opening up these massive flaps, exposing ourselves to extra risk of a procedure that we maybe are doing, once in a blue moon? Obviously, the doctors that are doing that routinely, mad talent and respect to them. But if Yomi can allow us to stay within our wheelhouse with standard implants and within the anatomy that we intimately work with, that we know that we're masters of on a day-to-day basis, I think it could be pretty compelling. And so here's Aralinda. She had been suffering with a denture for decades, and she was ready, to get back to being able to eat and enjoy her favorite foods. Pretty atrophic ridges. In a moment, I'm going to show you guys a video of her pre-op situation. And so, yeah, let's go ahead and scroll through this. So we did have a little bit of bone that was protected by those second molars. But we all know the quality of the bone back there is not the best in the area, often deformed bone. So we're going to pan through the spline curve. And then here we go. We got a pretty over-pneumatized sinus. We've lost a lot of bone through combination syndrome in the anterior maxilla. Not a lot of height underneath the floor of the nose there. And then over-pneumatized sinus. And then back to a little bit of volume, but, second molar's in the way. With some of these techniques that we have these days, like palatal approach or transsinus, it can open up the door. But most importantly, the big advantage with Yomi is that we're consistently getting those tighter osteotomies, no matter where we are, because we can run drills quickly to depth, exactly, just punch little perfect osteotomies. But then we can punch these little perfect osteotomies, right through the cortical plate without blasting our way into the sinus. We can just punch them pure, get that bicortical stabilization. We can then match it up with the perfect length implant. We can change widths in real time. We can adjust positions. You take out a tooth, you lose some plate, or you find some extra granulation tissue. You can just click that implant over just a little bit. You can stay fully guided, and you could just know that if you have a very limited amount of bone and you have to hit it perfect, I don't think there's a better way to give you that confidence that you're going to hit that exactly the way you wanted to hit it perfectly, and that you're going to be able to go back in and put the next drill there exactly perfectly, and then you're going to be able to go back in there and place the implant exactly there perfectly without deflecting or spreading or drifting. And so this is the way I ended up solving Aralinda's case. And so we ended up doing some palatal approach and some endpoint configuration, and we were able to take advantage of the cortical bone and the piriform rim. And then we're also able to really maximize the AP spread by hugging the mesial wall of the sinus, but without necessarily perforating in it, or in sometimes we're able to do transsinus. And so here's a little visualization of where we end up placing the implants. So in that tuberosity bone, because I'm able to predictably undersize the osteotomy and then deliver the implants with Yomi, like I'm able to get pretty solid stability in even some poor bone by getting bicortical stabilization. And then you're always able to just like look for little extensions and fenestrations of bone and just like sneak those implants into like exactly the absolutely optimized position within that bony volume. I mean, you can kind of shoot as best you can, but as we go through this spline curve of where these implants are placed, like what stands out to me is that I'm really just trying to squeeze the implants where I still have enough bone around them to make sure that I feel confident about their long-term prognosis of these implants, but I'm able to like maximize the length by squeezing between cortical plates in order to get the stability that we need so that these patients are still going home with loaded print visuals. So let's take a look at this one. This is Aralinda again, still same patient. And so there's that second molar. And then you can see here we are, we got this sort of site 3 area, and we're able to just like get it to the medial side of the posterior sinus there and maximize the length. We're then able to place a pallidly positioned implant by maintaining buccal bone volume, but engaging that lateral nasal cortical bone, but not really blowing into it where we're going to be worried about getting into like nasal mucosa. Sorry, it's a little glitchy on here. There's a nice piriform, or I guess nasal spine placement, still maintaining bony volume and still keeping everything prosthetically driven so that the screw channels are going to line up with the restoration. Okay, and then we can gauge the M configuration there and just like squeeze it between these plates of cortical bone to make sure we're getting the stability, but we're not blowing out into the sinus excessively. So, this patient, she thought she had no options and she got to go home with her teeth the day we did her surgery. And then on delivery day, she was eating an apple and we just gave her teeth like about a month ago. I don't have those photos like uploaded into this presentation yet, but she didn't have to go through more extensive surgery. We didn't have to have that risk of if any of those fail that like I'm gonna have like a sinus communication. And ultimately like everything's healed. She's chewing and she's moving on with her life and she had a smooth experience. And so for sure, for me, like in my practice, in my competitive area, like being confident enough to say hi to these patients and tell them that, yes, like with Yomi, I can take care of you. And yes, today you're going to get your teeth. Like you're not going to be going home with glue and a denture. You're getting teeth. We can take care of you. That's because of my training, my Yomi robot, and my amazing team. That's probably where some of our initial arch volume started to generate. And it's very rewarding to be able to, help provide solutions for these patients. And so here's Nympha, similar situation. She's another atrophic maxilla. Solved this one a little different way, but let's go ahead and take a look at her pre-op CBCT. So we're going to kind of roll through the spline curve, take a look and see what you guys think. So it's pretty apparent that you can see that we got a pretty severely knife edge ridge. Okay, so starting the pterygoid area, over pneumatized sinus, anterior extension of sinus. Okay, knife edge ridge. Very extreme knife edge ridge, going towards the premaxilla. Opening up to a little volume around the nasoincisal canal, another knife edge ridge. A little bit of volume. Over pneumatized sinus, other pterygoid. Okay. And so this is sort of a generated Pano way of how we ended up solving this case for Nympha. In this case, I found bone lateral to the nose and anterior to the sinuses. And I also added in an angled implant around the nasoincisal canal. But then I actually ended up doing a little bit of transsinus. Like Yomi is really powerful if you're really trying to maximize AP spread and you're just trying to sneak implants either just anterior to the sinus, or if you're trying to go transsinus through the mesial wall of the sinus, or you can go fully transsinus. And then, the fully transsinus implant, we always think of that as a blind implant because engaging that lateral portion of the nose, apically, when you can't see through the sinus, like how do you know you're going to get back there? A lot of doctors talk about going with feel. Well, with Yomi, you're not going with feel. You're going fully guided. And so you can make those punch cortical perforations to get, cortical stabilization and know that you're going to get the right size implant, the right stability you're wanting so that you have that prosthetic confidence. The other fun part is like, I actually did a little bit of like a lateral window when I was doing this case, and I was able to like lift the membrane out the way of the implants while advancing the Yomi surgical arm with a finger because it's almost like having a third arm at some points. I mean, when it's locked in, it's locked in. Like you could move it. It's got like power steering, but like it's not going to be drifting all over the place. And so you can like instrument, you can move things out the way, and you can advance that drill if you're trying to like protect a membrane. I know these are healthy sinuses, and arguably maybe we don't need to, but like, hey, if we can be more conservative and lower our chances of any sinus complications by elevating a membrane and grafting around it, why not? And Yomi really made that a lot easier, at least in my hands, to be able to achieve that all at the same time. Yomi does have some additional exciting advances coming out with like these types of topics, and so more for that to come when we get there. But just particularly being able to hit that target and know you're going to get it, like gives me the confidence to say yes to these patients. These are typically the patients that know what they're going to pay. And you come in and say, hey, I could do it for my regular fee or a slightly increased fee versus having to go and do a quad zygo or zygo teres or, some other kind of configuration. Like, those people are coming to me and they're saying yes to me. Like most of the time, I would say at that point. Okay, let's keep cruising. So here she is smiling. Again, no significant bruising after her surgery. She wasn't talking about massive pain. And I wasn't going home and losing sleep at night thinking that like, this is going to break down on me. Like all those implants had beautiful stability. So yeah, like Yomi to me is it's really about making difficult dentistry easier. And then how do we take that to our patients and give them better experiences? So, okay, so here's Jim. He had come in, he had a lifetime of dental problems, and he didn't want to have necessarily a locked-in denture. And so a big part of my practice these days is, using the Yomi surgical robot to explore the possibilities of FP1. And it's been a very rewarding journey. This is actually my first case. And so I think it's a good case to demonstrate at the start of the conversation. But, we've been evolving quickly with our FP1s. And so, these patients that have good, gums and good bone, like, do we really need to be like lopping off like half of their jawbone and giving them a locked-in denture? Like, would you want that? Like, I personally would rather have like a bit more space for my tongue. I personally would rather have like a more conservative surgery. I personally would rather have like more options if I need it. Like a lot of the time patients come into me and I start this conversation of, hey, this is all on 4, this is all on X. This is what, the 16 other practices are doing in my neighborhood. And then I tell them, but because of my training, my team, and my advanced technology, including my Yomi surgical robot, I actually can give you like a new option. We call it FP1, or it's a thinner arch, or a thin arch. And it's going to be smaller. It's going to be not as big and bulky. It's not going to be as painful. It's going to feel more like regular teeth. Yeah, it's going to cost more. This is a premium option. People pay more for it. It's helping me out from a business point of view. But when they see that we could do this, they also understand what we could do for them with their other options. And so it ends up really communicating quality. And patients like having the options. And so, when you give your competition this option and like they never even heard about it, it definitely gives you quite a bit of authority. So the reason that I like, Yomi for the FP1 protocol is that it really pays off to be as accurate as you possibly can. So, here we're going to be doing something between 6 to 8 implants, depending on the configuration that you're going for. We all know that a multi-unit is going to be about 4.8 millimeters wide, and a typical premolar or can often, even maybe an anterior or lateral, that tooth might only be like 6 or 8 millimeters wide. And so any kind of amount of drift of where that multi is going to be, whether mesial or distally into the papilla, is going to create an aesthetic issue for you. For mesial distal positions, like the more perfect you could be, the better off you're going to be. But the other part that comes into it is like the depth matters a lot. With like subcrestal implants and 3D implant positioning, kind of like the quickest, easiest, like good rule of thumb for implant depth that's been working out for me in my practice is that you should place these implants 4 to 6 millimeters deep to the proposed gingival zenith margin of your proposed design. 6 is going to get pretty deep, so I wouldn't necessarily go there, guys. You're going to be feeling like you're way underneath the gums. But 4, 4.5 like ends up being a very comfortable number where you're going to have a great amount of running room that you can really start to develop some better gingival contours. And so you need to be able to predictably place these implants to depth, but these are immediate extraction cases. Like what happens if you blow out a buccal plate, or what happens if you find some soft bone or some granulation tissue? Like if you've done like a stackable guide where you got like one plan, like hopefully that plan goes perfect, but if you need to change anything, and often these cases can be quite dynamic, you're kind of having to make adjustments, or you're going to have to freehand that one. But in Yomi, we're live guided. We're able to see what happens with that extraction and then optimize every single placement to give us the best chance of having primary stability. And so, these implants are going in rock solid, and we're able to predictably load these patients. And so here's a couple screens of the Yomi plan software where I've proposed my implant positions and where the screw channels are proposed to be. And then you can actually see the printed provisionals that are ending up for my day of surgery conversions. If you're looking closer at this, you'll see a couple extra screws and some extra plastic. That is the Yomi bone link, which is a critical feature of our full arch surgeries. I'll have a little bit more on that to come later in this presentation. But what I wanted to highlight is look how remarkably close the screw channels that ended up in my actual patient's mouth ended up being to the ones I planned. And that really has thanks to Yomi's control of angular deviation that we spoke about earlier in the Newgarden study. And just really being able to execute the vision that you had and make it real. That's for me a big part of the fun of Yomi. It's I can put the time in to plan this case. I can go that extra mile, but then I know I can make it real. And that's thanks to Yomi. So here's how my first one ended up healing up. There's obviously a little bit of defects in the back where we're making improvements, but the patient, this is still light years ahead of having a locked-in denture. The patient was thrilled. We were working on his bottom teeth with some veneers, which we finished at this time. But it's an exciting way to do dentistry. And so these patients end up becoming big raving advocates for you. They're literally going around and showing their friends who have had all-on-4s done and be like, look, my doctor can actually do it with natural gums. Holy cow, how'd you do that? Well, he's a great team, good knowledge, and his technology is amazing. And I've had several people come in off of those kind of referrals. So here's another patient. Here's Cindy. A little bit of a trickier case, but we still had essentially good general anatomy and bony support that she opted to go for the thinner reconstruction. And so we were able to do a little bit of regenerating because ultimately the teeth can end up being as a healing guide for how the patient needs to heal. And so here again, we have a view of the Yomi plan, and then we can see remarkably how accurate the plan is executed in the STLs that are printed and placed in the patient's mouth. I think I had one of them that was an existing implant that I didn't need to mess with, but I was definitely happy with that consistency there. And then here you can see a little video of how the provisionals end up actually guiding the healing of the patient. And that's another nice advantage of this fully digital workflow with 3D printing. And so, we're trying to get this idea of a hygienic seal where the teeth are thin enough, but their teeth are pushing enough on the tissue that once all healed, you're not going to end up having tons of places where food's going to get stuck. And that's definitely a selling point that a lot of my patients are excited about. And then here she is with her before and after. We did upper FP1 and lower FP3, but it's just a fun way to be able to be doing these procedures predictably. And she was thrilled. Okay, so let's keep cruising. There she is, her final smile. Okay, here's Nicole. This one, another great case where we have a pretty good amount of anterior architecture that's setting us up ideally for an FP1 indication. She had pretty significant perio that's not as visible in the pre-op photography, but she had lost really a lot of like her palatal bone. So a lot of like palatal probing depths, a lot of loose teeth, and she was ready to have something consistent, but she didn't want to have something big and bulky. The other one is like you'll have a lot of patients that have high smiles. I mean, like for those of you doing more all-in-X, like sometimes feel pretty sketchy to be like lopping off, 20 millimeters of bone just to get the transition line underneath a lip. So here's a kind of a view of what does working with Yomi look like in a full arch setting. And so you'll see that we've placed the bone link, and then the bone link is connected physically to the tracker and effector arm, which is then connected to the Yomi robot. And so this physical connection is really the main thing that helps the Yomi robot stand out, because there's literally no video lag or no data lag. Like the robot senses the patient moving in real time if there are any movements, and helps to keep your delivery of your surgical drills like right on target, even in a moving patient. And it's this connection that is allowing us to achieve the accuracy that we have found. And so if you're doing full arch, we end up placing these full arch bone links with striker screws. There was originally a kind of like, it's like a freehand approach. It feels pretty similar to placing an implant for people that have done enough of that. They do have another workflow at this point called the Yomi Link Arch, where if you want to be extra meticulous because you're worried about roots or you have potential implants that you're trying to avoid, you could do this procedure with a fully guided robotic workflow. I will say in my practice, because I've done hundreds of these, that I find that placing this freehand Yomi Link is pretty quick and consistent. And so that's how we get our procedure started. The other great benefit about this massive, rigid, fixed landmark is that for digital workflows, it ends up being an incredible fiducial marker. If we end up having a fixed bone link, we kind of have like a nice tripodization from like the lateral sides of the bone link, and then you can have like a palatal marker, which is a really consistent way to make sure that your digital files are being stacked accurately to get the outcomes that you need with an FP1 approach. And so here's a little video of kind of maneuvering the surgical arm of the Yomi robot into location. There's a couple of different sequences of order of like how things are locked in, but you'll see that it kind of guides you into like a certain angle and then to a certain position, and then it'll guide you to stop at a certain depth. It is possible if you really push like crazy to deflect away, but you'd have to be pushing pretty strong to get out of a position like that, and that would that would be kind of a strange moment. But when you're really locked in, it feels like you're on a drill press. It gives you that confidence to run smoothly through your ostomies to depth, and you're also maintaining your visibility. I mean, I can see everything that's going on here, and more importantly, I could feel everything that's going on. Like there's no extra friction of your drills in like a drill sleeve. Like the same feeling that I have when I'm doing like a free-handed implant placement, which I'm using to like assess the quality of the bone and try and get a feeling for what my stability is going to be like. That's all there with Yomi. We still have the same visibility. It just allows us to have confidence that you're placing it at depth without having to read the lines on the drill, which then allows us to have like maybe smaller incisions. And so it's a nice way to be confident that you're really getting to where you need to be. Okay, and then here's a nice little video of going ahead and placing the implant with the Yomi robot.
One of those like superstitious things a little bit that that makes me feel better just to double check everything.
So you can see the tracker and effector arm set up there.
Yeah, because that way you can.
And then here we are delivering a neodent implant. For full arch, a lot of the time I'll torque them out before they get to depth because I'm just trying to get max stability. But it's also definitely possible to torque them out right at depth. Like most of the time that happens for me. For those of you that are wondering as far as like, onesie, twosies, or just like your everyday implants, there's a completely non-invasive like tooth-borne link that you could place on the teeth for your everyday bread and butter type stuff. It's just kind of locked into place with a bite registration material and then tied with a screw. In my experience, that's had exactly the same accuracy as doing this bone length. And that's just an easy, non-invasive way for our everyday like routine, singles and doubles and coronal level restorations. There's a nice view of the locking in and the heads-up display. It's a very intuitive system. It really gives you like the different angles you need to know where you're at and to make sure you're on plan. Okay, and so then this is just a little bit of bonus. Here we can see that I've printed like the same day surgical temporaries for the FP1 case. We're delivering with rosin screws. And we actually end up using these teeth as kind of like as a negative bone reduction guide where we can drill any like XF bone to kind of scallop out the bone. And then another little thing that I've been enjoying doing is these like sling sutures that are really helping us as far as advancing the tissue around the provisionals. And so once I've delivered these provisionals, I then use these sling sutures to advance the tissue. If it's a case that's like a regenerative FP1, or if it's a case that we're maintaining the current papilla positions, we're going to leave them in place, but just kind of depends on what your surgical design is. But this sort of double sling suture is a game changer for any of you that are interested in trying to advance tissue around a prosthetic.
So through.
Don't move, honey bear.
I forget which paper it was published in. Perio Amigos, I think originally taught me it, and so props to them, Dimitri and Dr. Fadi. But it's pretty awesome. So it's just a great way to kind of snug in your tissue and allow your teeth to end up being like a biologic healing guide for your full arch restorations. And so here's a immediate post-op of the placement of that case, and we can see that we're delivering consistent depths, we're getting the stability we need, and we're grafting around these implants. But the implants are all lining up exactly where they need to be, not to impinge upon the papillas, and the patient's going home with teeth. A couple of these root banks I probably would shorten a little bit at this point, but it's always a journey. We're always looking to optimize our details. Okay, and so here's a photo of that case fully closed around the prosthetic. And so, we've all heard the saying, but I think particularly with the power of our printing and our digital workflows and the Yomi robot, like, the bone sets the tone and the tissue is the issue, but the pros is the boss. I mean, the pros like literally allows you to close against it. It's like almost like another type of primary closure. And so it's really exciting to be able to have the power of the Yomi robot and putting it in with a 3D printer at the same time in order to be able to predictably get these kind of outcomes. So, do you need to be that precise? That's obviously up to you, but for me, it's really allowing me to do more cases, to have higher quality outcomes, and to distinguish myself from the crowd. It's also more fun. It's keeping me on the cutting edge. It keeps you inspired. And, this is what I do with Yomi. I mean, there's a lot of other amazing KOLs, and they all have their own little niche. Dr. Smoller's big on like flapless and as painless as possible, and that's really important for these patients. So it's fun. It's like now you're at this place where you're helping develop this technology. What would you do with your Yomi? But what has it done for my practice? My practice is completely revolutionized. Like at this point, we're really a fully digital practice. I bought Yomi in 2022. I really managed to start implementing it and marketing it in 2023. And it's 2025 right now. But in 2023, I was able to drop my relationship with Delta PPO and grow my office by about 35%. And now I've set myself up for, not being insurance dependent for the rest of my career. I mean, that's priceless. And it's allowing us to stand out. I mean, we've all seen like the prices drop with the competition in All in X, but is everybody really providing the same outcome? We've all seen some dubious things out there, and being able to provide these options, like when I tell people, hey, we can do it this way, and our technology is that good that we can do it this way, it makes more sense when I tell them that my FP3 is still going to be a fair fee. We're not in this race to the bottom, because patients can tell that we've made an investment in providing them less pain and then more quality, and making sure that these teeth are going to go the distance, and that making sure that we can hear them and actually give them what they want. And so as far as my actual single implants, I would say we've blasted off. You know, you can see the growth in individual implants. You can also see the growth in, you know, actual arches that I completed. And then 2025, we're absolutely on track to have definitively my best year ever. I've been able to hire more people. I've been able to continue to grow my marketing. And I'm being able to be consistent providing these types of outcomes. And so, you know, it feels like we're really starting to turn the corner of developing this reputation. And, you know, it's always been, you know, it's been an anxiety working in a competitive California market. Like, where am I going to get new patients? How am I going to continue to grow this practice? And it's like, no, now patients are starting to hear, like, the marketing's been there long enough. Like, they know we got something unique for them, and we're able to deliver on it, and we're able to show them how we've helped other patients. And so, you know, it's been exciting. Yomi is just a part of it. Like, they're very straightforward about that. You need to have a robotic program. You have to have a marketing system. But to me, it was like the most straightforward story I could think of like, how can I really separate myself? And, you know, it was inspiring to be able to think about ways I can make this technology work for me. And definitely, you know, over the past 3 years, things have been for sure working out from a business point of view. So, you know, stand out with a robot. You know, do harder cases, get better results, treat patients faster, and provide stronger outcomes. You know, be like Daft Punk. You know, we've all heard that song, harder, better, faster, stronger. Be like Daft Punk. So thank you very much for listening to my webinar. Definitely happy to answer any questions that come up. And I guess I'll pass it back to Heidi. Let's see.
That was absolutely fantastic. I love the little ending with the Daft Punk there. A couple things that always stand out for me, Dr. Ewing. You are a lifelong learner, and it is clear that you invest in your education and your team, and you make the right choices. So I love it. It's a live guided surgical procedure. So I love that. Anyways, we do have a lot of questions here. So let's start from the beginning.
Let's do it.
And thank you for putting your questions in the Q&A box. So I'm going to start with the first one, and you touched on this a little bit. Can you hit on the ergonomics? How has the robot improved the ergonomics in the way you practice?
Yeah, so you know, like any new technology, there's going to be a little bit, you know, particularly as dentists, we all like to get a feel for it. You know, you have a little learning curve, like as you get used to it. And so adjusting to the link can take a moment, but then at this point, like I have so much trust in the robot that like I always visualize my drills, but like there'll be times where like I'm not even going to be like having to visualize it because I know I'm going to be right in that correct position. And so we're able to get to places where we need to be by trusting the robotic workflow. You either have the choice of like looking in the patient's mouth, or if your particular ergonomics you need to look at the screen, then you have like a nice big heads-up display where you're going to get all that relevant information you need to make sure that those implants are going to the right place. And then it's like the biggest one, it's like, how tiring is it to have to like read those depth drills? Like you're trying to read it, you're freehanding, and it's like, okay, there's blood and there's suction. It's like, okay, I need to kind of see to be able to see where I'm at. Like, I never even think about the depth once I'm fully guided. I'm just like, punch to depth, I'm good. But at the same time, like I don't have like the loss of like feeling where am I at if I was doing a stackable guided system. Like I can still see like, okay, is there any tissue impingements? Like, how did that implant that I just placed go? Like, is it where it wants to be before I go to the next one? And so you have visibility without having to read as closely on the drills. And for that's been helping me out from an ergonomic point of view. I think a lot of the doctors I talk to feel like doing a case once you're set up with Yomi is just is less tiring. As far as like onesie twosies, like on the regular OB Bite, like tooth-borne one, like, you know, you can place an implant once you're set up in like 1 minute, pretty much. Just punch, 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 go. And so that's, you know, definitely saving energy for me on a day-to-day basis for sure.
What about on your arches? I know, you know, doing arch surgery can be grueling on the body and on the practice. Are you finding yourself doing more arches in a day than you typically would without the robot?
I mean, obviously that's a big question of like where you're at with your journey and your team. For me though, like I think it's kind of a wash. Like I could do a similar amount. But I think the Yomi Arches days, I know I have like that peace of mind that I'm not gonna be like looking at the printed PMA or the final pano and being like, oh, well, is that gonna be right or not? It's like once the implant's in there, it's like it's right. Like every time. So I say that saves me some of like that stress. But I have had days where I've done 4 arches of fully guided robotic Yomi surgery and had the patient go home with same day teeth all in one day. And I think that's enough for pretty much any of us. I mean,
Yeah,
and,
for
and it's
sure.
also like, like, are you sure there's people that can maybe do it quicker, but is quicker than an hour? Like, is quicker always better? Like, I'm not always sure. And I think the other thing that really doesn't come up with these conversations is like, sure, you can do a quick surgery, but how's the pros going to go? Like, are you going to
Yeah,
have to be fiddling with like multi-units or like tissue adaptation? And so I think that the Yomi workflow or like the entire digital workflow, it's not just about quicker surgery, it's about quicker to a higher level of care and making like the pros actually get to where you want it to be. And I don't think enough people really talk about how hard finishing the pros can be once patients start talking about midline or occlusion or food traps or, I think surgery is sexy, but I think finishing the case is harder a lot of the time with pros. And that's why I know that if I want to have like the right AP spread, the right restorative thicknesses, like, I go Yomi fully guided, full arch, like really like 99% of the time in my practice for sure.
that is great. So, here's another one. I bought my practice and I'm deciding what to buy first. I would like to grow my implant business. Do I wait to buy the robot or do I buy it now?
Um, I mean, I think everybody's a bit different. Um, I was definitely like when I saw the opportunity and I felt it and I kind of knew what it could be for me, like I was like, all my chips, all in, take a loan, let's go,
I love it.
But you don't have to be like me. There was some time when it was maybe a little stressful, but at the same time, like it's rewarding that I'm able to be taking care of patients the way I am now, and I'm glad to be here.
Wonderful.
Um, I think if you're trying to get an implant practice going, you got to start laying your seeds of your marketing, for sure. That doesn't necessarily have to mean like big spend right away, but you need to start thinking about like what is your story of like why they would come to you. And so for a lot of people, like the robot might be part of that, or it could be you're like into loaded or you're into like interior aesthetics. Like, you have to kind of think about what your story is going to be to the patient. If you're in a market where there is no robot, I mean, it's kind of a no-brainer. It's not like the robot's doing it for you. But then when you start saying, hey, I could do this, like I can do that this way. Oh, well, the periodontist and the oral surgeon like said that's impossible. I'm like, well, I just invested in this. I could literally do it. We're doing it totally differently. Like I never get pushback at that point. Um, so I think that'd be a bit individual, but I went in and it worked out for me.
Yes, it
I
did. Just
think,
by looking at those statistics, we could see it definitely worked out. And you
yeah,
mentioned you're all in, your team is all in. You've invested in your
yeah.
team, you've invested in marketing. This is not a one hit, you're going to continue to work and grow and get better and better. So thank you. That was a really good, honest answer. Okay, now we have a couple of technical questions. You mentioned that Yomi will lead to no screw holes through undesirable locations. We know that has part to do with implant position and part to do with abutment timing. I know how Yomi controls the implant placement. What do you do to manage the MUA timing and get your screw access holes where you want them?
Okay, that's a good question. Most of the time for FP1, we are fortunate enough that with the power of Yomi, I could plan for straight implants almost always. And so Yomi is going to give me if it's straight on straight with less than 1 degree of angle variation, like we're going to be money for sure. As long as you have the rest of your digital workflow in place too, because you still have to have good prosthetic planning and understand where you're going. The angled ones, yes, unfortunately, there is no timing on the robot right now. I think they're working on, they're having a restorative update with Neosys. Like Neosys is an amazing company for always updating stuff all the time. It's really remarkable. At one point, there'll be like digital libraries, but right now, I don't know if I have a quick one I could show you guys, but right now we have a section where I'm simulating. Let's see if I can go up there.
Well, you know what, Dr. Ewing, I'm going to pause
Yeah.
you right there, and I'm going to ask the person that asked the question to connect with you. And I want you to have a one-on-one conversation
Oh,
about
sure.
that because it's a little more detailed.
I
I don't want to omit any of these questions.
the
And there's
short
a
the
lot
short
more.
the short one is just that you could plan a simulated abutment, and then you just look at the bend and like angle it within the mesial distal relationship of the pre-plan. So there's ways to plan for it for sure.
Excellent.
Okay. Thanks,
So I
Heidi.
know that person is connected to Randy, and Randy will make sure they get that taken care of. Next question. My problem with guided surgery is that I don't have enough room for the guide and the drills in the back for the patients who can't open wide, which is why I went back to freehand. How will Yomi sell for that, or does it?
So, but there's the first thing is that with stackable, obviously the hard part is that you have to get the drill over the sleeve. And so with Yomi, there's no sleeve. And so you do just place the drill at the tissue level. So you're not having the same interarch distance issues there. But that said, they also came out with a lateral axis protocol where it changes like the lock-in like features or the sequence of how the drills lock in. Like the drill locks into like the point position of the tooth, but it doesn't lock in with like the angle of the handpiece. And so the robot will like kind of flow, like you'll start drilling it and it'll flow itself into like the right screw channel alignment and then allow you to place the depth while still maintaining like a guided workflow. So shorter drills or lateral axis flow, or also the fact that like, yeah, you're not having to get up and over that metal sleeve that's providing the guided aspect of the stackable guide.
Great.
Yeah.
Perfect. Recommendations for learning the FP1 protocol.
I really enjoyed going to Paulo Carvalho in Portugal. For those of you that are interested in a little hop across the ponds, Europe's pretty pushing the limits on a lot of this stuff. It was much more affordable than a lot of courses here. That's a great option. That said, though, there are a lot of amazing courses that are coming up. Instarisa, Dr. Morales has a great course. I'm going to be doing some mentorship at some point. It's just like anything. You got to continue, you keep taking courses. There's more courses out there. I think most of the people are starting to have, like Full Lecture Masters has one. I think most people are having some kind of FP1. But it's fun because it's still a place where we're all developing like our own recipe or flavor of it. But yeah, I will be doing some educating on robotic FP1 coming up, hopefully within the next 6 months.
I hope so too.
So if you're interested, then hit me up and I will
right,
make
exactly.
it happen.
Exactly.
Yeah.
Does Yomi slow you down versus freehand? And are you able to do multiple? I think we answered that one. We already know you're doing multiple arches a day. What material are you printing?
I think it's like once you're set up, it doesn't slow you down. I think definitively, if you're trying to place it perfectly every time and you're including like dealing with prosthetic issues, I think it saves you time. But yeah, I could freehand arches really quick. But it's like when I'm trying to maintain the standard and not have to deal with complications or mispositions and have to work with it later, like that's a big part of why I stay fully Yomi.
Great. What material are you printing the provisional with? Onyx
Tough. And so this is part of it. Like we're worried that these materials are strong enough, but we know that if the screw channel is not in the papilla and it's not too pallid or too buccal, like it's right in the center of mass of this provisional. And so when I started using Yomi, I was like, I could push the limits on these materials more predictably, that I'm not worried about stuff breaking all the time. And that's a big part of why I'm restoratively driven, and Yomi allows me to be that restoratively driven every single time. It's like anytime you have a deviation in a screw channel that's like off of the plan, then your designer's having to make an extension, which is going to be like not supported all the way. And so you're just creating, fracture risk. So like being perfect is allowing you to make smaller restorations that are still strong enough to handle the patient's anatomy and their function.
Great. Oh, good answer. Okay, now here's a current Yomi user question. So for some of you that have not gotten your hands on the robot, this may not make sense, but I do not want to avoid asking this question. How often do you find your landmark is off more than 2 millimeters? I've been using Yomi for a year and I have had some issues with that. How do you work around sedated patients with bone link? Those are the same doc has two questions.
The landmark thing is a bit of a learning curve. usually like I will be honest, like there's been times we could talk to Patrick and my office is calling and, he's picking up right away. And we're like, hey, we're a little bit off. And we're leaning on our robotic support specialists to help us get these answers questions. Most of the time it's just coming down to like, oh, we mistimed something or our assistant didn't quite rotate something all the way. So those types of issues, now that my team is really getting to where they're at, like, or making sure your link's good. Like there's a few areas that we can like look at and I can try and troubleshoot specifically with you. But I will say that the more I've done, like the more we recognize it, the more my team recognizes it, the less it becomes an issue. The sedation side of things, yeah, that's definitely a conversation. I know Neosys is working on that. I'm fortunate enough at this point that I have a nurse anesthetist who's one of probably the top guys who's been working with Yomi doctors in California. And so he will go with like a laryngeal mask airway as like his emergency airway. And so he'll like let me put a link on top and on bottom, and he feels like he can provide any kind of a bagging with a laryngeal mask airway. I know in the past working with like an MD anesthesiologist under general anesthesia, like that was more like, okay, we'll do one at a time and we'll kind of scooch the mask around the link, and we feel like we could still get a good seal there. And so that's a conversation that when you're bringing on any kind of like, new anesthesia provider, whether CRNA or MD, you just need to reach out to a couple of people that are doing it and just have like a good workflow. And then they might be able to like talk to a colleague that's doing it and just to reassure them. Because they're going to be a little bit confused about it if you don't like pre-prep them. But with the pre-prepping and just a little bit of information, we're having success.
Great. And Dr. Ewing, I'm going to add on to the one question that went on before Landmark. And, at Neosys, our job is to make this transition into this new digital workflow seamless, but we don't know what you don't know. So if you don't tell us where you're having trouble, we can't come in and get you trained on where the issues are. We have a great program called Yo Pro, where we actually send your assistants to a school and we will train them to troubleshoot your robot. So please get in touch with your robotic integration specialist and they will work through these issues to get you proficient and really becoming an expert at this. And you've been so wonderful at, growing your business and training your team and embracing everything that is offered to you. And we can't tell you how much we appreciate you. So for any other further questions, reach out to us. I know we've kept you a little longer than we said we would. It was an absolutely great webinar. Any other parting words you want, Dr. Ewing?
I just encourage everybody to continue to enjoy their career and continue to help take the best care of their patients. Happy to answer any specific questions, and let's keep seeing where dentistry takes us.
Awesome. Thank you. Well done. And thank you all to the attendees that have joined us. We are going to sign off. Have a good evening, everybody.